Well, thanks to Bruce and Ashley for letting me have just a few minutes to talk to you guys. I'm really excited about our CMA program and wanted this to just be an opportunity for you to learn about what the hospital and the school is doing to get qualified, certified medical assistants into our hospital. And we have the deal of a lifetime. So, are any of you familiar with a CMA program at all and what that means? What kind of job that is? Kind of, okay. Ashley might be, if I miss something, you fill in the blanks, but we have CMAs that are in our doctor's offices primarily, although we do have some that will work in our emergency room. So they go to school, I think the program's at least
3 days a week.
But for the total length, it's a year?
It's 2 years, a year prerequisites and then a year of actual core classes.
Okay. So 2-year program, and we see all kinds of people in this program, and what happened, the way that this developed was we were having a big need in the clinics that we have several clinics, probably 40 or 50 now, and we can't seem to get enough people as fast as we're getting physicians. So we need people to fill those slots, and a CMA would do things, when you go to the doctor's office, I'm sure you all have seen them, but they might do some registration if needed, but they're primarily a clinical part of the physician team. So that's why there's a lot of school involved in it and a lot of work involved in the medical field with that type of a degree. So we developed a program with Bruce and BCTC, and they were so great to help us with this. But to identify, we wanted to grow our own. And so to do that, we have set up a school to work program, and it's a scholarship where we would have just regular opportunity for you to do an interview, and then we select up to 5 a year. And this will be our 3rd cohort, and Bruce and I were talking about that. That's hard to believe, but we can select up to 5 people to be in this program. And the reason I think it's just so amazing is we identified there are people in our community who would go back to school if they didn't have to worry about a job, and they didn't have to worry about benefits, and they didn't have to worry about leaving the job to go to school. And I don't know if anybody here would agree with that, but as somebody who's spent most of their life going back to school and working, it's very difficult. So we wanted to make it as easy as possible for good candidates to come into the hospital. And so with this program, you will be hired as a 40-hour-a-week employee. You will get full benefits, everything, PTO, health insurance, dental, all of that. Then you will only work, though, 3 days a week, because 2 days a week, or did I say that backwards?
Flopped, yeah.
3 days a week you're in classroom, and then 2 days a week you work. So everybody would say that's awesome. Let's just say that's awesome, right? Okay, make me feel good about this, because it's awesome. So you get all of that, and you don't have to pay anything for school. So we roughly estimated about a $20,000 value just in the school alone. That doesn't count the time that we have to backfill the position that you've been hired to do those 3 days a week. So this is easily, I would say $50,000 to $60,000 proposal for someone to come in to be able to get that opportunity. Yes, so we are starting interviews. I have to check my list here. We're going to be starting interviews for this. Application deadline for this is October the 20th, and if you go out to our website, you will see a CMA School to Work job opening, and you can go out there and fill out that application.
All right, Clark Regional.
ClarkRegional.org, yes. And I have business cards with me if you all have any questions after you leave here, because that's usually what happens. But there's a front and back to that to explain the entire program. And then we want to have all the interviews done by October 25th and get everything ready to notify the recipients by the end of October, so that you will be invited to a reception to be held to make the announcement. And just to spend a few minutes on that, it's a big deal for us in our community. And when we have a reception or a dinner, we're not really sure what we're gonna do, we would expect the recipients to bring a friend, a family member, spouse, whatever, and be a part of that whole deal, because it's a very big deal for the hospital to be able to award somebody their changed life, basically. So I believe education changes lives no matter what. And so the event will be held November 9th at the hospital. We will have the press will be there, so the newspaper will be there. They'll take pictures. Your family's invited. So we just try to make that as nice, because it is, again, just a huge factor in having good applicants and to change futures for people. So, any questions? All right. So I'm just going to switch gear and be the trainer for a minute on professionalism and etiquette, and how our hospital operates, and what I've seen over the last few years, and how to help candidates be as professional and well branded as possible. So if I were to say McDonald's, give me the first thing that pops into your mind. Food. Don't be shy.
Colors, their trademark colors.
Their colors, okay. Their uniforms. Nobody thinks of Ronald McDonald anymore?
Their speed, their logo.
Yeah, their logo, right, the big M, the french fries. Usually when I ask that, you'll get 100 different answers, but usually those trademarks are in there. So if I were to say, what is your brand? Have you ever thought of having a personal brand? Bruce, have you ever thought of having a personal brand?
I have.
Have you?
Yeah.
Great, that's awesome, because we have to market ourselves. And I've been in HR a long time, and I've seen a lot of different things in my day. And today I saw something, and I'm not even going to tell you what I saw, because you won't believe it. I didn't believe it. I should be used to these things by now. However, there is a sense of business decorum and professionalism when you come into any professional setting. But our hospital, we have a dress code, and it's very defined in what we want our employees to engage, and how they should present themselves, and how they should behave. So we have standards of behavior, we have code of conduct, and we have a dress code, along with various other things. But primarily what I see is that we've become very laxed in our culture these days. And I see people that don't necessarily make a big deal to get ready anymore. And I'm probably dating myself, but when I was a young girl and I was in school, elementary school, the teachers, they all wore dresses or suits if there were men teachers. And when I went to church, people dressed up, they wore hats. It was a big deal. When people went out for a date, they got dressed up. They made it a special event. And we don't do that anymore. And I'm not saying that's good, bad, or anything like that, but it's just kind of by the wayside that people don't really take a lot of pride and prepare themselves for the day or the event. And so when you come to a hospital, I'm gonna make you all talk to me now. So if you go to a hospital, what are some things that you expect?
Cleanliness.
Cleanliness. So we would expect the building or the employees to be clean. Exactly. Very good. What else do you expect?
Organized.
To be organized. Yes.
Kindness. Like, when you lost, because it's kind of huge building, people, it's like, who is a first comer? I mean, we won't expect somebody help to go somewhere.
Yes, you expect us to be caring, kind, helpful. You're coming to us to help you. You want us to do those things. So people will be positive.
Want you to be punctual.
On time, yes. Sometimes that doesn't happen in a hospital, but yes, we want our employees to be on time. Yes, absolutely. What else? Anything else that you can think of off the top of your head? Somebody to show you where to go, because you're not going to know where anything is, even though there are signs everywhere. We just don't see signs, right? We're kind of information overload, and we see signs everywhere. We just don't really then see them. So we need someone to take us where to go. We're a little bit afraid and insecure when we go to a hospital, because they might ask us to take our clothes off and put on one of those little flimsy gowns, or they might stick something in us, and we just aren't very cool with that, right? So we want that person to really help us and explain things to us. So those are just some things that we work very hard at the hospital to ensure that our team members are trained and they understand. What I have seen is our society is probably very shallow on the other end of the spectrum, and people only see what they see, and they make judgments and assumptions, and right, wrong, or indifferent, that's just the world that we live in. And people will make assumptions that they know how much money you make, how educated you are. They make assumptions about lots of different things based on their visual of you. Now, I'm in and out of the hospital all day long, in and out of my office, and people, for the most part, never meet me. So I have to market myself when I run into them, or when they see me just walk by. I want them to know that my brand is professional and I'm kind. So I make it a point to look people in the eye and speak to them. So when I came in here, what happened? Do you remember when I walked in?
You said good morning.
Said good morning, yes. So in about 2 or 3 seconds, you noticed if I was in a good mood or a bad mood, right? I didn't have to tell you, hey, I'm in a great mood, or I'm really not in a good mood, right? You don't have to do that. So you made some impressions about me, and you don't have to, I won't ask you that, what those were. So I made an impression on the group one way or the other, right? Those people that sit in our waiting room, that's all that they're going to ever see or know of me usually. So it's important that I present myself as a professional. I wear my name badge so people know that, and I didn't introduce myself. I'm sorry. Deidre Bradley from the hospital. I'm Vice President of HR. So people is kind of my business, okay? So I kind of have an idea about how people are. So I always think of myself, when people are in the hospital, they don't have anything to do but to watch how we interact with each other and the walking back and forth. That's all that they know of us. So if I don't like working there, or I don't like my coworkers, and I don't look at them, and I'm on my phone, and I look like I just rolled out of bed, and I didn't really brush my hair, because who needs to brush this hair? And I didn't put any makeup on, and you don't even have to wear makeup. I do, so I'm just going to throw that out there. I have to wear makeup. Makes me feel better about myself, not for anybody else. And so those are the things I really try to take pride in, my demeanor and my look and how I project warmth and kindness, because that's what I want people to know and think about me. And so as I brand myself, then I'm also very aware that I brand my family. So I don't want anyone to ever think Campbell's mom is terrible. She's mean, she's not very nice, she doesn't seem happy, she never looks like she's put together. I wouldn't want my child to think that, and I'm sure that's not what you would want to think of you. And so then I have to think I'm branding my profession in HR, I'm branding my office in the hospital, I brand my hospital. Anytime that I wear this badge, I'm an ambassador. But even aside from that, if people know that I go to this church, then I'm branding everybody else that goes to that church. If I were to give a hand motion to somebody in traffic and they follow me into the church parking lot, that's probably not a good brand, right? We could all agree. Are we all on the same page? Okay. You understand me, don't you? So I just all of that goes into your brand. And so I just want, if you've never worked in a professional setting, there are just a few things that you've got to remember. And things that we do expect. And I do see sometimes it's very hard to train people that maybe didn't have that growing up, or they weren't aware of those things. And as you're just starting your career, I want to just kind of give you that heads up on some things about professionalism. So dressing and how you prepare yourself is very, very important, because you have to package yourself for the day. Like I said, not everybody's going to get to know you. And to know you is to love you, but they're not going to get to know you. So you want them to have this image of you. So how I interact with my emails, if I'm getting right back to people, if I call people back, if I have a smile in my voice when I answer the phone, and we all know when people don't have a smile in their voice, right? They're not smiling when they're answering the phone. We've all been there and done that. So that's really important. whether you're in this program or you're going to Wendy's to work. I just want to give you that benefit of, from my perspective, for an employee to an employer, of what you can do to be very successful in life. So clothing and appearance are very important. Our expectations are that you're going to bring a positive, energetic enthusiasm to your role. Nobody wants to come to the hospital and be treated by somebody that's not going to be positive or enthusiastic to help them. Typically, people aren't well when they come to the hospital, so they don't need our baggage. They don't need somebody that's not going to be nice to them to take care of them. Now, really, the only time somebody comes to a hospital for good things would be a baby and maybe cosmetic surgery. We don't do cosmetic surgery, so people, for the most part, they're coming there to have, for a good reason would be to have a baby. And even that can be a little bit unsettling. Those aren't always good outcomes. For the most part, people don't feel good when they come there. So we want to make sure that they have a positive experience. It doesn't mean all laughing, hey, getting ready to give you an enema. It doesn't mean that. But it could mean that you're just polite and respectful to them. That there's a difference there. Or you're just going to stand beside them and say, hey, we're here to help you. That right there is very, very important to the way these people will remember you. Team player, respectful, sometimes in offices, especially where CMAs work. In the ED, when I go over there, and I try not to go over there too often because I don't know what I'm going to see, but sometimes there's loudness, yelling. Not yelling, but they're, hey, I need help in here. In an office, it's very quiet. And it's not something that you would be at the front of the room and yell to the back, hey, can you bring me to those files back there, you back there, right? We wouldn't do that. So those are some things that I always kind of get tickled about when people come and they're like, I didn't know I wasn't allowed to say things like that. So we don't use profanity, we don't yell at each other, we don't tear down the team, and anything that could tear down the team is not going to be positive, right? Somebody agree with me. Somebody.
Amy.
There you go. I was looking for that, Bruce. I'm a preacher's kid, you know it had to come. Let's see. Attendance is so crucial. So somebody said showing up for work. I think that was you. Yes, we expect people to show up for work, and we expect them to be on time, and we expect them to stay their full shift. This tends to be a little bit of a mystery sometimes to people when they start a job. So in your first 90 days at the hospital, it's an introductory period, and that's for us to kind of feel each other out. Is this going to be a good fit for you? Are we a good fit for you guys? You're going to be a good fit for us. So it works both ways. But I can tell you, a lot of people will miss a lot of work during that introductory period. Now, I'm old school, and we used to call it probationary period, but that's when you wanted to shine like a new penny. You wanted to do everything right, and then, wait till day 91 to show your real self. No, I'm teasing. No, don't do that. Just be that way all the time. But you really want to make a good impression on this employer, all right? So that's very important. So we expect you to come to work. We expect you to come on time and not go clock in, go to eat breakfast, give yourself a look, and then go out on the floor 20 minutes later. That's not how that works. You're expected, if your job says you're supposed to be there at 8, you be there 5 till, and you're gonna go far just doing that stuff. And then to leave early. A lot of times people want to leave early for the day. So part of being a team player is knowing if I'm gonna leave early, that might leave you to do 2 rooms, to double the work, right? You might have 2 rooms now to service, okay? So this is you all know this, right? This is just a good refresher for you guys, I'm sure. Okay? So with the program, I'm going to kind of get back on that for a second. With the program, it is, if you're selected for this, it is a 36-month commitment after you graduate. So if you don't actually get into the program until the prereqs are complete, correct? So you're in school for a year, and then from that year forward, it's a 36-month commitment. So that's really not that bad in lieu of everything that we're providing. So just keep that in mind, that we do expect you to stay that 36 months, and you will sign a promissory note to that effect. As I mentioned, there will be a reception honoring those who are chosen, and we would expect that you would dress appropriately and maybe even a little bit more fancy for that. And I've just seen this happen in the past where people weren't really expecting their picture to be taken and put in the newspaper, so they were a little bit concerned about their dress. So I just wanted to give that heads up, and we'll talk to anyone that is in the program about that as it comes up. But if you need some help with interview wear or the reception clothing, we have this organization. It's called Dress for Success, and you can take one and pass it down, and I'll leave those for you, Bruce, because the referral would have to come from the school. But they help you not only with clothing, not only with those kinds of things, but they also do interview coaching. They do help, they'll help you with your resume. They do a vast lot of things that that you can take advantage of. So I would really, really encourage you to do that. So the referral would have to come from Bruce. It is in Lexington, so if you have trouble with transportation, you can call them and they may be able to even help you with that. So I would really encourage you to take advantage of that you're never going to go wrong if you look your best. Ready to get into if you're still working on your prereqs and this interests you, we need registrars all of the time. We need housekeeping. We need a vast array of workers all of the time. And what some people have done, they've gotten a job there and then they'll apply for the program in the next year. So we always have those jobs available. We try to be very cognizant that people are in school, so we have PRN, which means as needed, and then part-time work too, so you can work that around your school schedule until you get in the program.
Where would you find the jobs? Would it be on
Yeah, clarkregional.org. You go there and it will load up all of the openings that we have. We currently have about 70 jobs open. Can you believe that? I mean, people say there's no place to work, there's nothing for me. We've got jobs. We just need really, really good people to come and work.
Your first year is basically taking gen ed requirements for the program to get into the medical assisting classes. So when the medical assisting classes start, they start in January, and that's when you start the School to Work program with Clark Regional, and they begin paying your tuition and working you and everything like that. If you're new to the school and haven't started those prereqs yet, that means that you can take advantages of grants and scholarships to pay for your first year. So the Work Ready Kentucky Scholarship pays for a medical assisting degree up to 32 credit hours. So basically the whole 2 years, even though Clark Regional is not paying for the first part, you're getting it free tuition.
Program, there's 2 paths. You have a diploma pathway and then an associate's degree pathway. The difference is 3 courses. So psychology, math, and heritage and humanities. Most people tend to have that, so most people do end up going the associate's path. Bruce was saying too, there's a new scholarship option this year, which is helping, I think, out tremendously within our program, and it's that Work Ready Kentucky Scholarship. So there is links on our website on how to find that, even the medical assistings page. I think they put it on all the programs that can utilize it. So it does help. So there's been big interest with that. But it is a 2-year, and so it's offset. We have one branch in Lexington at our Leestown campus, and then the branch down here at Winchester for medical assisting. So when you all are starting in January within the program, I have students in Lexington that are finishing the program. So it's offset, and it's helped a lot, I think, in that aspect. I have some part-time students, so that's even an option. I work on one-on-one with the students and their schedules, because I know children, full-time jobs, things like that. I say it's not ideal. I try to keep up with you all and keep myself sane. But the program, medical assisting program, gosh, I don't even know how many years it's been open and running in Lexington. The old coordinator who I graduated under had started it at the old, if anybody has ever heard of it, Central Kentucky Tech college before it joined the KCTCS system to make BCTC. So it's been in Lexington for years. And Clark Regional, my very first year in this position, I was told, hey, we're opening one in Winchester. So it's been fun getting to know down here. I volunteered in the community. I knew people from down here from when I was in high school, but never really knew much about the community. And I think what BCTC does down here for its community is wonderful, and that's one reason why I'm happy to have the program down here. There's been a lot of interest, so I'm happy to see the numbers go up. This year, I think we have 11 graduating in December in the program, so I just hope that it keeps going up. The program itself is medical assisting. It prepares you for the national certification upon graduation to be able to say that you are certified. So that's our goal. So far, I'd say I have a 95% pass rate on the national exam, so I think the things that we teach and the things that we hit on definitely are what you all need to know. And I know the girls who have been at Clark Regional with the scholarship have actually gotten, I'd say, a little bit not ahead of everybody else, but it does help, right? Because while you're in school learning this stuff, you're actually going back and doing hands-on those other 2 days with somebody within the clinic. So at the end of the program, you do have an externship, which everybody currently still does, and I hope to keep doing it. Might overwhelm them this semester, but all the students, regardless of scholarship or not, do their externship at Clark Regional from down here. Give or take, like this semester I do have 3 students that travel from Lexington to come down here for the program, so I actually found them spots in Lexington just because of the traveling, and they had asked that I do that. But everybody else will be starting their clinical externship next week at Clark Regional. So even if you're not in the program, you do get a little bit of experience within their office. And essentially, and actually last year 2 of the girls were scholarship students and 2 of them weren't. And the 2 that weren't also, or one of them also got a job at Clark Regional after graduation. So there's still that possibility even if you don't do the scholarship. So any questions in general about the program?
Is this a program that could lead a path into like a physician's assistant or something
Okay,
like that?
so actually I do have, I've had 2 graduates who that is what their end goal was going to be. They both knew that coming into it they wanted to go on and get their bachelor's and then their master's to be a physician assistant. It is actually UK, even though they don't, I say using quotations, require anymore that their applicants into the PA program be a nurse aide or work in so many hours within a clinic, even though that's not actually part of their application process anymore. They have stated that it looks better. And UK PA school actually told one of those students of mine to actually go back to school at BCTC and become a medical assistant first. So that's actually how I ended up getting them. So UK even acknowledges the starting out with medical assistant role, getting that experience in the office, because it's definitely a different experience than a nurse aide, to go on to PA school. So yes. Even for me, going on after college, I got my associate's degree. I'm currently working on my bachelor's degree at Midway. Midway also has a great scholarship for KCTCS graduates to move on for a bachelor's degree. So that's also an option. I'm doing healthcare administration. I like the admin side of things. And they also have a master's degree in it as well. Even the pathway into nursing, even though there's not overlap of classes that count towards nursing, I have a lot of students who start out in medical assisting as a stepping stone. It gets them into a health office and really figure out which way they want to go within the medical field. So, any other questions?
You mentioned diploma versus associate's degree.
There is no difference job-wise. At least I've not seen it. It's both paths allow you to sit for the national exam.
Can I just interject? Are you talking about an online CMA program?
No.
Oh,
So
okay.
we have two paths
Okay.
within our program itself. So say you go the associate path. When you graduate, you get your associates in applied science, a diploma in medical assisting, and 2 certificates. If you go the diploma path, you get the diploma in medical assisting and 2 certificates. The difference was those 3 courses that I had mentioned. Job-wise, because I have graduates who just get the diploma and others who go and get the associates, there's not been lack of hiring because of the associate's degree not being achieved. But like I said, both of them do qualify you to sit for the national exam. So,
Now, will you take credits from other schools? Like I took psychology at Midway, and I took I believe biology for something else.
yeah,
And I know those are prerequisites.
they
right?
are. So when you apply to the college and all that gets transferred in, whatever they transfer in as is what we take, what I go by.
Okay.
And my understanding is Midway is one of those ones that are kind of, I think, not interchangeable, but I knew most of mine, all of mine transferred to Midway. So I would assume that
Okay.
coming from Midway. But if not, there's ways that we work and I take a look at a few things.
Okay.
But as far as the transfer credits, it would go through the college, and what the registrar puts in as what the equivalent is.
I've had to take some chemistry classes and anatomy and
Mhm.
biology and all that, so I didn't know if that would.
They have a lab.
Uh-huh.
Any other questions?
Talk a little bit about what a medical assistant does.
What it actually does.
And
What
what
we
jobs
do.
you can get and the wages and everything.
So what we do, like Deidre was saying, there is the admin side of things, administrative. So some of your courses are going to be teaching you how to deal with an electronic medical record. There are still topics in there for paper charts because there are clinics that still have paper charts. Not everybody met the deadline. It is very expensive to switch things over from paper to electronic. So you still might be working with paper charts. I did. I worked in a clinic where I did both for the same doctor. Everything we put into the electronic medical record, I had to print out and put in the patient's paper chart. So you still learn about the paper charts as well. So there's the admin side, co-pays, insurance, scheduling, and then on to the clinic side, right? So someone is rooming the patients, so you're gonna learn to take people's vital signs, assist with in-office procedures, prior authorizations for insurance companies, giving injections, TB skin tests, phlebotomy. We learn phlebotomy. Some offices have their own lab within the clinic. A lot of more offices are starting to go more to centralized labs though, but you still may actually have to do it. So anything that you can think of, just about anything that you've had done at a doctor's visit, more often than not, they've actually been medical assistants with the occasional RN or LPN thrown in there. So we are very versatile within the office. There are days in the couple of offices I worked in that I went from the front of the office and checking people in to the back and helping with the providers that day. So it's just, you're very versatile and you'll be on your feet a lot. There are clinics that you'll work and there'll be 40, 50 patients on the schedule for the day. Other clinics you might work and there might only be 10. It depends on the patient load, especially vacations for providers, if they're going to be covering, right? I know nurses and medical assistants in OBGYN have longer hours typically than a lot of offices and see a lot more patients than some, that maybe podiatry. But everybody finds their special place. So specialty offices as well. Primary care, you're going to get your most experience of utilizing all your skills. And then you might figure out, oh, I really like women's care, or I like cardiology. We also learn and perform EKGs on patients, as well as you get to do it in the classroom. A lot of this stuff that you will be doing out in the clinic, you get your hands-on experience and learn it actually hands-on in the classroom and through your externship at your clinical site.
Now, the phlebotomy part, is it like where you could go to, say, Quest or places like that and do phlebotomy for them? Just as
So,
You
the-
can only work at the hospital if you're gonna be on phlebotomy. Oh, we need some of those.
So, currently at BCTC, okay, so our program itself, if you just go through the medical assisting program and, medical assistants are trained to do phlebotomy, you don't actually get a separate phlebotomy certificate to be a phlebotomist. However, we have started back a phlebotomy program. We don't currently offer it at Winchester. It is at Lexington, and hopefully in the spring I'll have enough to do it down at Danville. That's where it had been before, between Lexington and Danville. However, if that is something that you are wanting, there is a way for us to work that out within the medical assisting program, with your lab class as well as your externship. You just have to get that many venipunctures that would qualify you for it. And that's something too that I say, because students are like, well, I want it. You may want it, but we'll have to work it out with the externship, if you're doing it through medical assisting, to actually get you into the lab and see if you can get those sticks. If it's something I would recommend, if it is something you really do want, to actually just go ahead and do the phlebotomy certificate. That's separate. That's just my suggestion, because it's a lot easier than having to worry, because when you're doing your externship with medical assisting, there's a whole lot of stuff that you have to check off on at the externship. That way you're not too focused on just getting these 100 venipunctures, and you're not getting to do your other checkoffs, because if you don't get those other checkoffs done, then you don't graduate. So it's one of those,
One of the other
really
things
have to strive, because I did have a student who was at a clinical site who did their own lab in the office, and within like 2 weeks she got 100 venipunctures, because just about every patient was having to have blood draw. And so they knew, she had mentioned them, I really want to do phlebotomy, can I do this? And every blood draw that came through their patients, they were letting her stick, so, she got it within 2 weeks. But for most of the sites, they don't really do the labs anymore within their office, the venipunctures. So getting you into that lab would pull you out of the clinic setting. So it's one of those, we just gotta work with it.
What's the difference in doing an emergency room? I know that's a whole different world. I used to work in the hospitals, but.
I'm not personally, I'm pretty sure from my understanding, I don't know, you could tell me if I'm right or wrong. A lot of the, like through Clark Regional, and I wanna say, I think UK has some medical assistants who also work in the emergency room. It's more of the same as a tech job, a nurse aide job within the hospital. So you're rooming,
But because of the phlebotomy piece
But
of it.
the phlebotomy and the injections,
Right,
some of the
there's a lot more they
injections.
can do.
So there's a little bit more that you could do as a tech back there, but it would basically be, I think, the same role. Which is basically the same when you get into the office, rooming the patient, giving them the shots, or doing the phlebotomy if need be. But techs, on the other hand, nurse aides don't typically have that job in a doctor's office, because you have to be able to do the shots, or you need to be able to do a blood draw. That's a good question. So never thought of it.
So I get a lot of questions about salary, pay,
Thank you.
starting
I know
pay,
it's a yes.
average pay, things like that.
It is a wide variety, and I'll go ahead and tell you that. It will depend on location as well. I know, I say I know, I really don't know, down here with Clark Regional.
Yeah.
I do know in Lexington, a lot of the offices in Lexington have upped their salaries just this year for medical assistants. Recently, I was with Central Baptist, I was told they have 2 tiers of positions for medical assistants. One is a medical assistant. So say you graduate and you haven't taken the certification exam, or you didn't pass it. They will still hire you as an MA, medical assistant, because you've graduated from the program, you are a medical assistant. That pay for Central Baptist is $12 or $13 an hour, and then their next tier is those who are certified. So So certified medical assistants, you got your national certification, and it's $1,506. Clinic I worked at, they readjusted right before I left, and I think they start theirs off at 13. So even still, right there is a big, $2 difference within Lexington.
But if you don't wanna, go through the traffic and the
Right.
headache of working in Lexington.
Right.
Are there opportunities here?
And we have
There
free
are.
parking. It's a great environment as well, but our, rates start at 11.70 to 12, and then they go on up to about 15. However, we are in the process of reviewing those to see if they are competitive.
Now, you guys are a Life Point Hospital now, aren't you?
We
Yes.
are. Mhm. And being a Life Point hospital, you have the ability to transfer, or just what we call staff share. So if you wanted to get more hours or more experience in something that we don't have at Clark, you could go to Bourbon or Georgetown.
My mother-in-law is a phlebotomist over in Bourbon County.
Oh, really? What's
Yes.
her name?
Linda Swanson.
I don't know everyone at Bourbon, but I've heard that
She's a little tiny
name.
woman. She's like,
I didn't know that
I don't
about.
know.
I didn't know that about them
Mhm.
with LifePoint.
Mhm.
That's interesting. I like that.
Mhm.
So roughly the best thing to say, though, honestly, I know starting out, at least 30,000 a year is typically what we're seeing with medical assistants. So it is on the rise. One of the things, and that I do have one adjunct who teaches a class, so she'll be teaching the lab classes. She is an LPN. A lot of positions you will see are put as medical CMA or LPN. Within the medical office, they're very similar to the skills that they've been trained on and even do. A little bit of difference, just her and I talking. She said really what it comes down to is certain IVs. That she was trained on how to insert an IV, and other than that, she said pharmacology, lab, clinical aspect, things like that are just the same as medical assistants. So that's one of the things you might see with job postings when you're looking for medical assistant jobs is CMA or LPN.
you guys do help with job, besides this program, if you don't get accepted to that program, you guys help with job placement and stuff too, don't you?
Job placement, I know what we have with workforce. They've really revamped the workforce, and there is an ongoing job board.
Yeah, we have our career center, and we help any BCTC graduate get placement. We help them with resume, interview skills, and looking at our jobs board and getting you connected with
Yes.
employers.
Yep. I know that has been a big change, just in my experience from even being a student here. Not saying it wasn't there when I was a student, however, finding out about it was, unless you knew exactly what to ask, but now they've gotten really active. Not only that, I keep your all's email, and I get a non-school email from you all upon closer to graduation, as well as a cell phone number. There's many times that I directly get phone calls from clinics, and emails as well that say, hey, we're looking for a medical assistant. By any chance, do you have any recent graduates or previous graduates that might still be looking for a job or might need a job? So vice versa. Say you get a job, and after 5-10 years, you can always reach back out to me and say, hey. But I do try myself to put you on contact of places, and keep everybody up to date. Yes.
So what's the salary while you're working at Clark?
That's a great question, and I'm gonna have to really think about that. I think that we started them out at the base of a CMA, and then we gave them a 5% increase once they got their certification. So I don't do math very well, so I just work with people. I don't know what 5% of.
I'm not told.
Do you know, Bruce? You're good with
It is a
numbers.
contract between them, kind of.
11.70.
Well,
Just
10
round
would be $1, and half that would be about 50, so I'd say close to 60 cents.
Yeah, you're right. Well, it would put you over 12.
Yeah.
Oh, over 12.
I don't currently know. That's one thing I don't talk to the scholarship students about. Again, it's kind of the same as I don't know.
We wanted to make it as competitive as we could to take people out of a job that
Right.
was not giving them anything, but then a lot of this is waitressing jobs that we're competing with, and
Right.
tips, you can make big money.
Right.